All right, so we're moving on to our next topic, which is medical terminology. And we're going to be focusing on primarily Latin and Greek root words. We're looking at prefixes, suffixes, and root words. What do these three things mean? Do we know prefixes and suffixes? What do those mean? What is a prefix?
Before the word?
Yeah, so it's a small chunk that comes before a word. Suffix
Is after the word.
Yeah, so we'll have a word and then a suffix will be like a little ending that we put to the word. And a root word?
Like the middle.
It's like the core, like the middle, like the most important, right? It has like the big meaning of the word, and it can often stand by itself, but not always. And so most medical terms, I shouldn't say most, I'd say all, every medical word is made up of these mixes of prefixes, suffixes, and root words. And if we can start learning these root words and these various prefixes and suffixes, we can start kind of decoding what the meaning of some of these words are. I'll give you an example. So here's a sentence, and there's various different prefixes, suffixes, and root words in here. What do we see? What words do we see that have prefixes, suffixes, and root words? While excavating the foundation for a geothermal plant, my companion Naya found a fossil. Under further inspection, she realized it was a pterodactyl.
Geothermal.
Geothermal. What do those mean?
Geo is like rock.
Geo is rock or earth.
Yeah. Thermal is heat.
Thermal is heat. So it's the heat from the earth. What else do we see?
The last word.
Yeah. Pterodactyl. Do we know any of these root words?
Dactyl is.
Dactyls can be fingers. Dactyls are fingers, and ptero are wings. So we see wing and finger. So it's basically a flying reptile, right? It was a dinosaur, right? This flying reptile that had wings and fingers. Pterodactyl. Other root words. Sometimes there's simple words that we don't even think about. For example, companion. Come means with, and pan is actually bread. So a companion is a person you would break bread with. And that's what a companion is, right? They're your friend. They're a person that you would sit down and you would break bread with and share a meal. Companion. What about excavating? Do we know cavity?
It's like a hollow.
A hole, yep. So cavity is like a hole. And X is to like remove, right?
Extract.
They're like making a hole. You're digging a hole, right? You're digging a hole, and the ing means it's an action that's happening right now. So she's digging a hole in the foundation. Oh, what just happened? There you go. Hold on here. I clicked the wrong button. There you go. Foundation can also be broken up. We have ground, found, which will be ground, and nation is forming. So it's ground forming. So you're digging in the hole in a ground forming earth heating plant. My friend found a fossil. Inspection. We know spec, like spectacles. So spec means to look at, or eyesight. So to inspect means to look at something. So Upon looking at something, she realized it was this winged, fingered reptile. What was that? So that's what I mean, that we're able to like break these words apart because that's how vocabulary works. Whenever the science community has to create a new term or they discover something and they have to give it a new term, they use these simple building blocks that we find in Old Latin, if we find in Greek, and they take them and they build these new words together. So that's what we're looking at today. We have a whole list of medical words. It's going to be a whole hour of medical terminology. Are you ready? Are you ready?
I'm ready.
There's a lot of words, so I don't think this is a great way to teach vocabulary because we're looking at everything, but what I'm doing is I feel this is a tool for you. I have taken all of our root words and I've grouped them in categories that are kind of themed, and then that way you can go back and you can refer to all of these and study them and memorize them to help you prepare for the CNA and the nursing program. We probably have 150 words that we're going to talk about today. I don't expect you to remember all 150 words after an hour-long lesson, but rather I want you to be able to go back and use this tool to help you learn all of those different parts. And so our first group are organs. Here's our list of organs and all of our root words that are connected with it. Right? Gastro, meaning stomach. Can you think of any words that have gastro in it?
Gastrointestinal.
Gastrointestinal, yep. So that's your stomach, and then intestinal, your intestines. So all of the medical terms dealing with the stomach will always have gastro connected to it. Hepato is liver. We'll see that. Cholestasis is with our gallbladder. And interesting enough, it actually means green. So if you actually look, remember chloroplast, when we looked at the cells, the word chloro actually is the color green because the gallbladder creates this green. We actually took the root word for green itself. So that's for our gallbladder. Our spleno is for our spleen. Pancreatos for pancreas, and adrenal glands. A lot of these are very similar. The big one that's different is gallbladder, right? But they actually use the root word for green because it's the color green. And hepato is liver. The other ones, they look like the word itself. So that must be spleen, that must be pancreas. So these are the two that I would say that we probably need to focus on. And gastro, if we don't remember already. All right, so these are organs. So anything dealing with those organs is going to have that root word built into it. We got bones and muscles, bronchia, dorsal, osteoped. What do we got? Do we know any of them? Which ones do we know? Take a guess. Do we know any of these words? And think of words that we already know, like osteoporosis, carpal tunnel. Any guesses?
Carp is probably dealing with like the wrist.
You got it. Exactly. So we got the wrist on this one. Is there a W on wrist? I can't think now. I've been looking at too many words all morning. Yes. Wrist. What else we got? We looked at the term osteoporosis. What was osteoporosis again? when we were talking about the bones.
That bone.
Mhm. And then remember that there were all of the holes, and the holes were getting bigger, and it was getting really, really weak. So osteoporosis was like the decaying, like the bone was becoming really, really weak and fragile. So osteo means bone. So anything dealing with bones is going to have that root word connected with it. We know dorsa at all? Like being in Alaska, a lot of times people talk about the dorsal fin.
That's back.
Yes, dorsal fin. So a dorsal is the back of our body, right? Dorsal meaning back, dorsal fin. Any others? Head is kind of fun. You might know a word like centipede. Centipede. Okay,
Is that limbs?
Yeah, foot
Foot. Okay.
itself. So P is a foot.
Oh, okay.
Because if we think about centipede, what does cent mean?
6, 7.
A lot bigger than that. Think about a centipede, though, right? Centipede is cent means 100. So, like a century is 100 years.
Oh, okay.
Century is 100 years. We have 100 cents and a dollar. We have percent is for everyone. So per means for 100. So out of every 100%.
How interesting.
So cent means 100. So a centipede literally means 100 feet. 100
Okay.
feet. What is a millipede? They're found in Southeast Asia, very poisonous.
Is that more than 100? That's like a million?
It would be, yes. It would be, how much is a mil? Not a million. Millennium. How long is a millennium?
Oh, 1,000. Okay.
1,000. Yeah. So a mil means 1,000 in Latin. So 1,000 feet. All right. So we got bone, we got back, we got feet, we got wrist. Bronchi means arm. So a lot of the things with the arm have that word bronchi attached to it. And like brachial, I know like the nerves, we talk about like the brachial nerve, and like the brachial plexus origin is the nerve right here on the side. So the brachial is always like arm related stuff. Myo is muscle. All of our muscles will be myo. Scapule is our shoulder. Cost. I don't know what that one means, to be honest. Let's take a look. Oh, ribs, of course. Of course, our ribs. And so there's all of our parts. So if we see that in a root word, in a scientific word, we know it's having to do with that part of the body. All right, heart and circulatory system. We talked about this last week. Some of these words, some of them look like words we know already, like this one. What could artery stand for? It sounds just like the English word we use.
Arteries?
Yeah, and arteries, very good. Then
Veins.
vein, very good. And I actually learned this today. I didn't know this. Like when we talk about a phlebotomist, like that's one of the jobs at the hospital is the people who work with blood. For some reason, I thought phlebotomist had to do with blood, but it's not. It actually has to do with veins. So the phlebotomists are the people who take your blood, right? And so they're actually extracting the blood from your veins. And we talked about that we draw blood from veins, not from arteries. And so the phlebotomist is the one that's taking the blood from the vein. All right. Cardio, we know for sure. What does cardio mean?
Heart.
Heart. Give me some words that have cardio in the root word.
Cardiovascular.
Cardiovascular. What's the heart doctor?
Cardiologist.
Yes, the cardiologist is a heart doctor. Do you know when we actually put those little things, EKG, the EKG to actually like measure the heart itself? Because it has electricity, like we're using electricity, right, to measure the heart. So we have electro with the heart, cardio, and we're actually graphing it. And so it's a gram, an electrocardiogram. Electrocardiogram is an EKG. Electrocardiogram is what we call calculating those readings of the heart. Aorta was one of the parts of our heart. We talked about that aortic valve, which is that part going into the heart there. So the aorta. And these are important ones. You may or may not know. Hem is a root word for something. This one is Greek. The Latin one is sangu. The Spanish word is sangre. Any guesses on that one? Any guesses on that one? We know it has to do with the circulatory system. What could it mean?
Like air.
Ooh.
I feel like it's not correct, but maybe something like that.
Not air. Are you ready? Blood. Blood.
Interesting.
So like hemoglobin, right? The parts of blood. We talked about that it had hemoglobin. So heme is blood. Anything dealing with the blood is always going to have that heme root word or the Latin root word sanguine. Blood. So all of these have to do with the heart and the circulatory system. And here's the meanings. And that's what I mean by these slides are tools for you. So you can go back and say, all right, all of these root words have to deal with the heart themselves. Phlebotomist is taking our blood through the veins. We have heme is root words with blood. Cardio is everything with the heart. All right, and then let's move on to our digestive system. This one should be a lot easier. What do we got?
Appendix.
Appendix. We got it. Appendix.
Colon,
Colon.
esophagus,
Yeah. Esophagus.
I think you're gonna have to tell us this one.
Oh, you really? Okay. You're gonna hit yourself in
And-
intestine.
Oh,
Oh, right? Just like, oh man, are you kidding me? Intestines, right? So anything with the intestine. So think about like gastrointestinal, right? Gastrointestinal. Well, so that inter will be the intestines there, right? The last, we know gastro. What's gastro again?
stomach,
Yeah, that guy right there, stomach. These two are going to be the harder ones. We looked at hepatat already, which is our liver. Rene, like renal. Do we know rene or neph? That is going to be our kidneys. Our kidneys. So anything related to the kidneys, like renal disease, right? Renal meaning kidneys. Anything that's being done to the kidneys is always going to have that rene prefix into it. Okay. Any questions on these? All right, so these are all of our major body parts, right? So we had our bones and muscles, we had our circulatory system, and then we have our digestive system. Then we can start adding things to them. Like these here. We have custom procedures. So these are different things. These are going to be our suffixes that we can do to any of those body parts. What do we have? Do we know any of them?
Gram is an image.
Yes, Graham, we're going to take an image. Mhm. Same thing with graph, right? Graph means to put it on paper, right? To either like write or again, have like an image. A graph. Like a electrocardiograph, electrocardiogram. Do we know ectomy? For example, if I have a appendectomy or a tonsillectomy or a
Vasectomy.
yeah, exactly. Vasectomy. What is
Removal? Removal of something?
removal? Yep, we're cutting it out. Removal. Yeah, so an ectomy is a removal, so we can remove any of those things. So what would this be? What would we do for the removal of the gallbladder? So we would have a chlorosil, and I think I'll put it here, ostomy. Here's our word. And so it's a surgical procedure to remove the gallbladder. So we see the color green because the gallbladder is green. We see ectomy, which is the removal. So we know we're removing the green thing. And that's literally like what it's saying if you break up the words. Like removal of that little green cyst thing. That's scientific words for you. Cut out that green thing. Come on, that's funny. I admit that's a little funny. All right. Let's keep going. All right, so cut. We had right and right. Do we know any of these down here?
Is that cutting too? No?
Yeah, it has to do with cutting. Yeah.
Like an incision?
Yes, an incision or cutting a hole. I think this one is hole, and that one is like making an incision. Well, do we know scopy?
I don't.
It's like a camera, like.
Yes.
You know.
Like that, or scoping, we're looking at. So scoping is to look at, right? We're looking, videoing, taking pictures of, we're exploring with a camera. So a scopy is we're taking a camera and putting it somewhere in someone's body. And so there's all of our words. Cutting into and opening. Yeah. And so we can add those to any of those words. All right. Let's move on. Here's some other common root words we see in the medical field. Which ones do we know? These two we know for sure. Electro.
Electricity and heat.
It's using electricity. Thermo is heat. Very good. Do we know any of the other ones?
Chem is drugs.
Yes, drugs or medicines. Anything dealing with drugs.
Bi is life.
Yes, bi is life, like a biopsy.
Echo is sound.
Yes, sound. And so a lot of times, like what is it called when someone is pregnant and they have the word escapes me. You know where the mom gets the picture of the baby taken? Echo isn't that word. Isn't it? Who knows? I haven't had a baby.
That's an ultrasound.
I haven't been pregnant, ladies. Ultrasound. Oh, you're right. So there's an echo in that. Oh, I think there's another word for ultrasound. That actually has,
Echiogram.
yeah, echiogram. Because that would be like sound, and then gram is like writing it. So it's like taking an image of the sound. Echiogram would make sense. Taking an image of the sound. Mm-hmm. Car seat is actually cancer. So anything that's cancerous will have that like carcinogens, all those different things would be cancerous related things. And nous is knowledge. I'm pretty sure. Yeah, knowledge. So anything with knowledge. Okay. So we did test and procedures. Let's look at pathology and function. So again, these we're going to add on to any of those body parts. So like if we take appendix, we could have an appendicitis. What is an appendicitis?
Inflammation.
Inflammation. So if we see itis at the end of the word, it means inflammation. What would be a gastritis? Gastritis.
That's gas. In gas. I don't know. Sorry.
What's gastro? Gastro? What's gastro? What part of the body is gastro?
Is that stomach? I can't.
It is stomach. It is stomach. So gastro is stomach. And then if we add the itis ending, it would be the inflammation of the stomach, gastritis. What about laryngitis?
Lungs, right?
Oh, close. Lungs is not laryngitis. So lungs.
I can't remember what laryng is again.
Yeah, the root word for lungs is pulmonary.
Oh, okay.
So, or another one you see is like pneumonia, but that isn't lungs, that's actually breathing.
Okay.
That's actually the process of, it's like pneumonia is preventing you from breathing. Pulmonary, like your pulmonary artery, it's going to your pulmonary, your sacs, which are your lungs. So the root word for lungs is pul, like anything pulmonary is going to be your lungs related. Larynx, your larynx is that tube that goes down into your lungs. Your larynx is that tube that goes down and then it splits and then you get into your lungs. So your larynx is that tube. So a laryngitis would be a swelling of that tube. So again, you're seeing difficulties breathing, right? Because they're like, they have a sore throat, it's red, inflamed. A laryngitis is the swelling of the throat. What else can we add itis to? We did appendicitis, we did gastritis, we did laryngitis. What about your tonsils? What are the swelling of your tonsils?
Tonsilitis.
Tonsillitis. Oh, we've got itis is swelling. What else do we know? Do we know this one? Rhea. What does it look like? I see it in the word diarrhea. Or
That's what I was going to say.
exactly, and that's the answer. So what does rhea mean? It means heavy flow. Heavy flow. So dia, we have the fecal matter, intestinal, rhea, heavy flow. So it's a heavy flow of your poop, of your fecal matter. Poop heavy flow. Like that's the scientific word. Poop heavy flow. Like that's literally what they're saying. Any others that we know? Any others? So this one, like I was saying, like pneumonia, that PN here has to do with breathing. So anything with breathing, like pneumonia, that, blood, like anemia. Do we know anemia? Do we know anemia? So anemia is blood, and is like the opposite, like A meaning opposite. Anemia is when someone's blood is not clotting, it's not functioning properly. Someone has anemia, they bleed a lot because the blood doesn't clot. We see the word pneumonia. Pneumonia. Disease. This makes me think of the word pathetic when people are like, man, that's pathetic. Literally what you're saying is like, that makes me sick, right? It makes me sick to my stomach. That's pathetic. That. I'm actually seeing the word pathetic. All right, so again, other root words that we can add on to all of those. So those are our more complex scientific ones. I think the hardest ones are these and these are the hardest ones. No, sorry. These here are testing procedures. Testing procedures and pathology and function are our hardest ones, along with then all of the body parts. Then I have just some of our basic root words that we should know. So when we're looking at size, macro, micro, and mega, what do these mean? Macro.
Macro, wouldn't that be like super, super small?
No, it's actually the opposite.
Oh, super, super big.
If something's macro, like if we look at macroeconomics, we're looking at the economics of the entire world. If we look at microeconomics, we're looking at like the economics of like a small company. And so macro is big, micro is small. So micro is small. So think about the word microscopic. What does scope mean? Like colonoscopy, scope mean? Microscopic. What does that mean? Microscopic. What does that mean?
Looking through.
Yes, we're looking at something small, right? So micro is small. Scopy, like colonoscopy, means we're looking at, we're viewing something. So we're viewing something small, microscopic. And we use a microscope to do it. Microscope, microscopic. Breaking all those words apart. All right, what is mega? Mega.
It sounds big, but I have a feeling that's not it.
Nope, it is big. Your gut instinct was correct. It means big. So, and the difference is because we have those different systems. We have different languages. So macro in this case is coming from Latin and mega is coming from Greek. And that's what makes a lot of the scientific vocabulary difficult, is because we often have multiple terms based on different language families. Just like with blood, right? With blood, we have the heme, which is the Greek, and then we have the sanku, which is the Latin. And some terms use them differently because we have these different branches coming from our language groups. That's like we also, I mean, our language in general, English in general is that way, because of the history of the English language, because we had the Saxons that came over, we had the Anglos that were more Germanic, that were French speaking, that was Latin, and then we Saxons that were Germanic speaking, and then they mixed together. And so our language is this mixing of Germanic root words and Latinate root words. And we get really interesting vocabulary that we have to have terms that mean the same thing, but just have a little bit different feeling because of what language they come from. For example, we have the word gut and we have the word stomach. Right? They mean the same thing, right? Gut and stomach, but gut comes from the German. Stomach comes from the Latin. Gastro, gut, stomach. And so the only difference is stomach has this feeling of like it's a little more proper, right? It's a little more educated because it came from those groups of people. But English has a lot of these vocabulary words where we have the same word with the same meaning, but we have these different words from different families that we can use them for. So that's why like macro and mega are the same thing, just different language groups. All right, quantity. We're counting things. What do we got? Semi, mono, uni.
Semi, is that like half, right?
Yeah, it means about half, right? It's like a kind of, right? Half, semi. Mm-hmm. What is a semester?
Oh, okay.
What is a semester? Half of the school year.
Okay.
Trimester?
A third of a year.
That third of a year, that there's 3 of them, right? Because, and when we talked about pregnancy, right? A woman's pregnancy has 3 trimesters.
Okay.
A semester would be 2. Trimesters are 3. So tri means 3.
Uni would be 1.
Yes. Can you give me some words where it means 1?
Unibrow.
Yes. Brow.
Unicorn.
One horn.
Unique.
You're the only one.
Unicycle.
One wheel. United States of America. One country. So, yep. Uni means 1. What else we got? We know mono. Mono also means 1. So for example, we have a monocle. Monocle is where you only have 1 lens that you look through. Like those people, because I have like bifocals or 2 monocles where you just have like 1 lens and just 1 little circle that you hold up as a monocle. Monopoly, when 1 company owns everything. Mono. Where's the monopoly? It doesn't look right anymore. My brain has stopped working. Monopoly.
Bi means 2.
It's 2. Yeah. Bicycle. Ollie.
A lot.
Yes. A lot. Absolutely. And so you will see these terms in medical terms. Like if there's only 1, you'll see mono. Many, you'll see poly. If there's 2 of them, bi. Like we talked about bilateral. Bi means 2.
Mm-hmm.
Side. So if something is bilateral, there's two sides to it, right? There's bilateral. Me too. All right. Cool. Next is quality. Anti or contra?
The opposite or against?
Yes. Yeah, absolutely. So I think of the word like contradict.
Mm-hmm. Contrast.
Yeah, contrast. When I look at the word contradict, dict is word, like dictionary, like, right, your list of words. So contradict is to use words against it. So you're basically saying something that's the opposite, contradiction. Dictation is, so dict is like words, language. We looked at the word with the brain. We said your neurological system is contralateral. What does that mean? Our brain, our nervous system is contralateral. Again, remember that lateral means
That
side.
when, whichever side is functioning, the brain is using the opposite end.
Yes, we got it. The brain is using the opposite. So the left side of my body, the right side of my brain is using it. Right side of my body, the left side. It's contralateral. Anti is the same thing, means the opposite. So we got mal. Like the word malnutrition.
Bad.
Exactly. Yep. Mal means bad. So we see mal at the beginning or the end of a word, it means something is bad. It's not working. Do we know auto?
It happens without.
Ooh.
No.
Without? I think you're thinking like auto, like
It like it doesn't need. You don't. I don't know.
driving cars, right? That's what I was.
Well, even just like automatic or like
Mhm.
autoimmune disease. That's. I don't know. I'm just thinking.
So auto means self. Self. So if something is automatic, it does it itself. An autobiography, look at all these root words here. We got three things going on here. Auto is self. Self. Bio is life. Graph is to write. So I'm writing about one's life. So an autobiography is a book about one's life that someone wrote about their own life. If we just have a biography, it's a book about someone's life, but someone else wrote it. So if I wrote a book about Helen Keller, it would be a biography on Helen Keller. Or if I wrote a book about myself, The Amazing Story of Sean Story, ooh, that could be a fun title. The many stories of it would be an autobiography. So auto is self. Autoimmune disease. Do you know death?
Bad.
Yeah, I think of it as just like doesn't function, right? It's not doing what it's supposed to do. It's something's wrong. And so I think of the word dysentery.
Dislocated.
Dysfunctional.
Oh, dislocated, dysfunction. Do we know dysentery? So this, what does enter mean? What part of our body is enter? Intestines.
Oh,
So what is dysentery?
something bad in the intestines.
Yes, it's like severe diarrhea. So diarrhea is like stage 1. Dysentery is like, it's worse than diarrhea. It's like the worst diarrhea you've ever had in your life. And the intestines start to like stop working, right? And it's just really bad. Really, really bad is dysentery. You see dehydration. So again, hydration, dehydration. So it's like bad. And so it's not working correctly. A is without. It's like the opposite. I don't know this one. This was a new one for me today. I don't know any scientific words with Eddie in it, meaning that it's the cause of something, but it's there. We can look for it. So quality and function. Here are ones you have to know. I've used it so many times over the last 4 weeks. If you don't know this, I'm quitting my job. I'm walking. All right, hyper. What do we got?
High.
High, above, right? Above the normal level. Hypo,
Low.
low. Give me some words. What do we know? Some science words using hyper or hypo.
Hyperactive.
Hyperventilating.
Active. They're active more than they should. Yep, ADHD, hyperactive.
Hypothermia.
Hypothermia. Hypothermia. What does that mean?
Cold. Temperature.
Below temperature, right? So our body temperature, the heat of the body is too low. It's below the temperature.
Hypoglycemic.
Yes. Hypo or hyper?
Hypo. I don't. Whichever.
They probably both. They're
Yeah.
probably both words.
Yeah, they are. Very good. What does glycemia mean? Like glucose. What is that? Sugar. Very good. So we see the sugar like in glucose. And so we see hypo meaning below, sugar. So the sugar level is too low. Hyper, the sugar level is too high. We see someone that's very hyperactive. They're bouncing off the walls. Here they're passing out. Very inactive. We got another one for you. See if you remember. Hypertension. What is hypertension? We talked about it when we looked at the signs of life and specifically taking vital signs. Hypertension is something we're looking for when we take vital signs.
High blood pressure.
High blood pressure. So that tension is the pressure, right? Tension, pressure. So hypertension, the pressure is too high. High blood pressure. Very good. Excellent, ladies. The last one we got here is time-related things. What does pre mean?
Before.
Before, so we have a pre-opsy, right? Pre-opsy, before the opsy, before the surgery. Pre-test.
Post is after.
Post is after, post-opsy. Post-mortem, what does post-mortem mean? Post-mortem.
After death.
Yes, mortem is death. Post is after, right? You always hear that in like CSI shows. They're like, "Oh, this happened post-mortem. It happened after they died." Re.
Again.
Retro.
Old.
Oh. Yeah, because it's that feeling like, oh, that's so retro. It means after the fact. So you're doing something afterwards. So something happened. This is kind of like a reaction, right? It's a retro. It's something that's happening after the fact.
So how would you use that in a word or a
Um,
sentence?
I've retroactively is the word that I use the most, meaning I acted after the fact. Like, man, I should have prepared. The disaster happened, so then we needed to do all of these things retroactively, meaning we needed to, we had to act after the fact, retroactively. Let's see if we can find some more. Words with retro. Retrospect. So looking at it. So spect is that idea of vision, right? So you're looking at it after the fact. That, ooh, we're kind of, it's like that. It's like the idea of reflecting, right? We're reflecting over it. Retroviral, that's a medical term, that we are fighting a virus after the fact. Retroviral, like there's retroviral medication to because I'm pretty sure retroviral medication helps you after the virus has entered your body. That's why it's retro after the fact, because it helps after the virus has entered the body. So retroviral medication will often stop viruses from attaching to cells. Like, for example, HIV treatment. They have retroviral medication for HIV that prevents the HIV virus from attaching to cells. But that means the HIV virus still enters the body, right? Someone is exposed to HIV. It enters the body, but the virus isn't able to attach to any of the cells because they have a retroviral medication. So it's medication for after the virus enters the body. Does that make sense?
Yeah, makes sense.
So after the fact. All right, what else we got? Do we know any of these? We did look at these before. And we're specifically talking about heart rate. We have tachycardia and bradycardia. Do we know which one's which?
So tachy is fast
Is fast. We got.
and brady is slow.
And so a tachycardia would be like someone has a really elevated heart rate. Often could be a warning sign. That's one of our warning signs of heart attack, right? Tachycardia, that increased heart rate, something is happening. Do we know neo? Neo means new. If something is new, neo, that we put on it. Like words that I see a lot is like, we talk about colonizing. And neo-colonizing or neo-colonialization is a word I hear a lot. Neo-colonialization is like
Neonatal.
yeah. Oh, neonatal. Is that that would be your first birth? Neo being new birth. Neonatal would be a new birth. Natal is a birth. Neonatal. And then last one, crone or chronos has to do with time itself. And this is where I see the word chronic.
Oh, like chronicles and okay.
Yeah. So chronic, if someone has a chronic illness, it means they have that illness for a long period of time. Chronic pain, they have pain for a long period of time, right? It's lasting months and months and months. chronic, anything that's chronic, meaning lots of time. Anything else? That's for Tom there. All of those there. Oh. There you go. All right. So those are all of our different root words that we got here. So to review really quickly, we had basic organs, we had our bones and muscles, we had things with our cardiovascular system, we had our digestive system, we had other medical terms that we see. These are root words, and then all of our suffixes, right? Tests and procedures, all the things that we can do, different functions that are happening, things are swelling, and then our other words, sizes, quantities, functions, levels, and time-related things. We're going to take a little quiz. I'm going to do just fine now. Okay, 10 questions. Let's begin. All right, who would like to read our first question?
I can do it.
Fine.
Your laboratory test shows hyperglycemia, meaning excessive sugar in the
What would it be? Would it be the stool, cells, urine, or blood?
blood.
Blood. Right?
No. Yeah.
Yeah. And so what does hyperglycemia mean?
Lots of sugar, high.
Yeah. Hyper is high, glycemia is sugar in our blood. So we know what is our answer. All right, next question. Would like to read this one? Go ahead.
Because of cancer, the patient has been advised to have his lung removed or
Which one means
neurectomy.
yes, I see. Acme,
Is that how you pronounce it? Neurectomy? Pneumonectomy.
pneumonectomy. Yep. Is pneumonic, pneumonectomy. Pneumonectomy. We can double check. That would be my best guess. Let's try it.
Pneumonectomy. Okay.
Okay, here. Listen.
Pneumonectomy.
Pneumonectomy. Yeah, pneumonectomy.
Pneumonectomy.
Very good. Because what are some of the other ones? We know. What's otomy? Plexi? We didn't look at plasty, we didn't look at plexi, but we did look at otomy.
Mm-hmm.
Otomy. What was otomy again? It would be under our procedures. Otomy is to cut into, but we did remove, which is the ectomy. Excellent. All right, next question. Who would like to read?
if a substance is carcinogenic, it I don't know.
So we know carcin was cancer. Right? Those were cancer. Do we know gene or genetic? Genesis. That means life. So we have cancer and we have life.
Okay.
What would be our best answer? Cancer and
Would it be causes cancer?
you're correct. Because of that idea. So Genesis is like the origins, birth. That's why Genesis is like the first chapter of the Bible. It's like the beginning, right? Where it's coming from. So carcinogenic would be the life of cancer. Where did it come from? The origin of the cancer. What caused it? All right. Next one. Let's read this one. Inguinal hernia.
The patient has an inguinal hernia, which is in need of repair or
Your
the last,
hernia.
the last two
Which-
look the same.
Yeah, there's an H there. We know RIA. RIA means heavy flow, so it can't be
Heavy
that.
flow.
Which one would mean repair? Repair was not one of our words that we looked at. So one of these words would mean
The
repair.
one we don't know, which is the one on top.
The one at top. I don't think that is it. I don't think that's the answer. Nope. That is incorrect. So they're saying Rafi means repair. Going with the H. Means repairing. Ria is a heavy flow. Regia, rapid flow. Rexus is rupture.
Okay.
All right, next question. What do we got? Have a spirometer. What is meter? When I see that in the word, I'm gonna meter something like a
Isn't it like
thermometer
measuring?
or a speedometer. Yeah, exactly. So like speedometer, thermometer, we're measuring the heat. Odometer, we're measuring how far we've gone. Chronometer, we're measuring time. Chronos, meter, chronometer, measuring time. So what would we be doing if we had a device that had meter at the end of it?
So it would be measuring.
You're measuring the breathing. Yeah. Looking at, because what would looking be? Like the colonoscopy. What word means looking at?
Oscopy.
Oscopy, yeah. So if we were looking at something, it would be oscopy. If we were writing it down, what would it be? There's two. We would, yeah, it would be an image. So we could gram or graph.
Yes, correct.
What would be recording it or writing it down, right? So there is a measure. Perfect. Look at this cow. Next one.
Following a stroke, the patient had difficulty swallowing or
Oh, swallowing. So we're looking for a body part that has to do with our digestive system. Fascia, mia, phagia.
Phagia, dysphagia.
Dysphagia, very good, because it's like our pharynx, right? Our pharynx is that tube right in the back of our throat that goes down into our lungs, right? And then our larynx is the one that food goes down in front of it. So dysphagia. Oh, no, I had that backwards. Larynx is for our air, pharynx is for our food. The pharynx is where our food goes down, and that's what's happening.
Phagia means swallowing. Phagia speaking. Penia
So,
breathing.
yep.
Pepsia
Yep.
digestion.
Yep, we got it. The suffix gram. What do we got? Electrocardiogram. Electrocardiogram.
Would that be instrument used to record or process the recording?
The suffix gram is used in many terms, such as this. It means, what does the gram part of it mean? So electro would mean an instrument, that's electricity. Cardio is heart. Gram,
Measuring.
yeah. So it's the writing it down part of it. So I wouldn't evaluate, it wouldn't be evaluating and it wouldn't be processing. An instrument used to record. Yeah, I would say either this one or this one. What are your thoughts?
The record.
Record? It just means because that's what they're asking. So what does gram mean itself? And I feel here that instrument is more like the idea of electro, right? That it's this electronic, maybe, but maybe I'm reading too much into it. I think gram itself just means to record. Which one should we choose? I don't know. I'm torn.
Go with the top one.
One. Oof, we got it. All right, next one. Ooh, we didn't talk about this one. Resembling. If something looks like something, it's not it, it just looks like it. Similar, but not the same. What does that end in? We have closest, alma, oid, or algia. Do we know? I just know this from watching Star Trek because they talk about there's humans and then there are things that look like humans. They're not humans, right? They just look very similar to humans and they call them humanoids. So oids are things that are similar to. So it's like a neuron, it resembles, it looks and acts like a neuron, but it's not really a neuron, it's a neuroid. All right. What do you think? We see the kidney, right? Then if we know that's kidney, what do we got? Did you see it?
Bigger.
Yes, mega is bigger, right? At first you look at it and you're like, oh my gosh, I have no idea what this word even means. But if you take your time and you kind of break it apart, you go, oh, I see the word big in it. So it means that the liver, the kidney is getting bigger. Last question.
Tracheotomy.
Tracheotomy, very good, because that's the hole that they're putting. Oh, whoa, 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 whoa. I thought it was tracheotomy too. Stomy means opening. So it wasn't just a hole, they were making an opening. I suppose, more like a permanent opening with an actual like valve that's there. So a tracheotomy would be an incision. Plasty is surgical repair.
That makes sense. Stomy.
Cast over it.
Cutting open.
Yeah, so they're saying and I always hear the word tracheotomy, but I suppose that is actually what they're doing in the ER, right? Like someone's choking, they're breathing, and they need to make that insertion. They need to cut that open to make them breathe, is a tracheotomy. But if they actually have the hole itself with a valve that open and closes, that's like more permanent, it'd be a tracheostomy. Tracheostomy. Excellent. So we can review the results. All right, so this is a fun quiz. I actually have it linked in our homework that you can actually go through and look at them, because what I like about it is it actually then breaks them apart and actually shows you what all those different suffixes actually mean. And it's kind of a fun little way to study that way, to see which ones you know and which ones you don't know, and then take it again, and then go back a week later and take it again, and really kind of solidify that information. Because when it comes to learning vocabulary, a lot of it's just practice, right? They say your brain, because we were talking about the nervous system and like learning and processing learning, you need to see it, you need to hear it, you need to read it, and you need to write it 7 times for you to start converting it into your long-term memory. So the more times you can take these little practice tests like this, these little quizzes, and see which ones you know, learn which ones you don't know, and make those connections like, oh, plasty means surgical repair. Interesting. What we learn. So looking at homework really quick for this week, I just have 2 short assignments for you. First one is what we just did, this quiz here. I want you to take it again and really look at what are the ones that you didn't get and really break those words apart, because that is the purpose of this, right? It's more to see the ones we don't know and practice them and learn those different parts of the words that we don't know. So take it again and actually really look at the ones that you got wrong and why you got them wrong, and look at what the words mean. Assignment 2 is I've given you 10 words, and you need to break them apart and tell me what all the different parts of the word mean. So we have appendicitis, colonoscopy, hypertension. I realize I just spelled that wrong. Hypertension. Hypothermia, tachycardia, prefrontal cortex, colostomy, pulmonary artery, pneumonia, electrocardiogram. Break those words apart. Let's do the first one together. Appendicitis. What are the 2 parts of the word?
Appendix.
Yeah, append. And then itis.
Itis.
What does itis mean? Inflammation of what body part?
Appendix.
Appendix. And that's what we need to say. It's just, the APPEND stands for the appendix. The itis stands for inflammation. So I know it's inflammation of the appendix. That's what you just type and do that for these 10 words. All right, and those are the 2 assignments for this week. I'll the slides. Any questions?